Ahead on Straight Talk, executive orders having a local impact.
We want the most competent people. We don't care what race they are. We want the most competent people.
President Trump's order pulling back on all diversity, equity, and inclusion in the federal workforce. Now some major companies changing their policies as part of a wave of attention surrounding DEI.
I am not shopping there anymore. You will not see me at Target.
What's driving the push for this change and what it could mean for workplaces moving forward. But first, amid chaos on Capitol Hill. Changes at the National Institutes of Health mean hospitals and universities could lose billions in funding. What does that mean for Oregon's third largest employer, OHSU? Plus, as the hospital inches closer to merging with Legacy Health,
to deliver the right care at the right place, at the right time, by the right people, with the right cost structure.
we sit down with OHSU's interim president to discuss how it could impact Oregonians and how he plans to tackle other challenges the organization is facing right now on Straight Talk. Hello, and thanks so much for joining us on Straight Talk. I'm Stephanie Domerat. Now, this week we will tackle topics impacting Oregon and Washington. We'll dive deeper into the topic of DEI in the second half of the show. But first, we begin with a closer look at the challenges facing one of Oregon's top employers and medical centers in our region. A little over 3 months ago, we saw the resignation of OHSU's president, Dr. Danny Jacobs. Now, his departure followed several years of turmoil at OHSU. OHSU's board of directors then appointed a familiar face to step in and lead the university. Dr. Steve Stadum was named interim president in November. He previously served in leadership roles at OHSU from 1999 to 2016. I'm pleased to have Steve with us as our guest today on Straight Talk. Thanks for being with us today.
Thank you for having me, Stephanie. Appreciate it.
Yes, great to have you. Well, I want to ask first, what brought you back to OHSU? I heard you came out of retirement for this.
I did. So I had been at OHSU for 17 years, from 1999 to 2016. I served in different roles there, first as general counsel and then at the Knight Cancer Institute eventually. I took a position at the Fred Hutchinson Cancer Center in Seattle in 2016 as the chief operating officer, and I was there for 8 years, and then I retired, or so I thought, in September 2024, and I was asked to come back to OHSU, and I love the institution. I'm very, very proud of it, and I'm very honored to be there.
And you've been very busy. There's been a lot going on in the last few months. Let's talk about big news this week that's been impacting all research universities across the country. We're seeing major changes from the Trump administration at the National Institutes of Health. About a week ago, the agency announced it would make cuts to grants that support medical research by limiting indirect funding. Now, this would be for things like administrative costs to help run research projects. So NIH said these cuts would save more than $4 billion a year. And then on Monday, we saw 22 attorneys general, including Oregon and Washington, file a lawsuit to block Trump's decision to limit how it pays out these universities, such as OHSU's, for research. Oregon's Attorney General, Dan Rayfield, called the planned cuts, quote, a dangerous culmination of years of undermining trusted public health expertise. A judge temporarily halted those funding cuts as well. But I want to ask you, if these cuts do eventually go through, what kind of research would be impacted by this at OHSU?
Well, the research cuts that would have to be implemented would be significant. I can't say specifically, but I can give you an example of one of the projects that Jonas Sacha, one of our scientists, is working on right now, Stephanie, which is a universal flu vaccine. So we all know every year the flu vaccines are somewhat effective, but not as effective as we'd like, because the flu takes on different strains every year. It's kind of a whack-a-mole game. And this flu vaccine concept is to design the vaccine so it basically will work against all the strains. And this kind of research only happens at institutions like OHSU and scientific institutions across the country, because it's not yet proven to be working in humans. And so that process from concept to trial is quite involved, and it requires that kind of federal funding. And you know, the United States has led the world. America should be very proud of our scientific research. It's led the world for decades in this kind of research. How
much of OHSU's budget comes from federal funding or the NIH?
Right. So the basic funding from the NIH and federal agencies, because there are others, is about $300 million per year. And on top of that, we receive funding from private foundations, medical societies that are organized around curing different diseases, as well as philanthropic funding. And our total research funding is about $900 million.
Wow. So if this indirect funding cut happened, how much money would that look like that would be off the table?
We don't know exactly, but it's somewhere between $75 and $85 million. And it's important to appreciate that some of this funding that I spoke of is direct funding, meaning if you're a scientist, that money goes to your lab. It can only be used for your research. This funding bucket that the NIH distributes to all academic centers is used for, as you say, equipment, space, the kinds of facilities where whether you have a project or the next person has a project, you need those to do the research. So it's that funding.
Okay. Another Trump administration executive order targets transition-related care for minors. It prohibits funding for covering the gender-affirming medical care that we know. OHSU currently has a transgender health program for children and teens. Attorney General Rayfield has joined a multi-state lawsuit to stop this as well. But have you thought at all about any impact to that youth program that you have at OHSU?
Yes, well, I can tell you the impact right now is it's very scary for patients, families, and the nurses and doctors, the care teams. Mm-hmm. But we're continuing to provide the care. I will say this is an example. These executive orders are creating a lot of uncertainty, anxiety, confusion, and as you say, litigation. Another example of that is the ICE executive order, the immigration order. So at OHSU, we sometimes have law enforcement come to our campus, but we have a process to make sure that people refer them to public safety officers that we have. So there's no disruption to patients or students, learners. We don't want ICE coming up and they have a right to be there, fine, but we want them to work with the public safety officers. We don't want them coming up in the middle of a care procedure, for example. So we have to make sure, and there's been a lot of questions about that. So we're trying to make sure that people know what to do when law enforcement comes up, whether it's ICE or someone else. But it has raised a lot of questions, again, among patients and our care providers.
Have you seen anything like that with ICE so far?
We have not seen anything like that so far.
Okay. Currently, OHSU is one of only 2 level 1 trauma centers in the state. So these facilities operate at the highest level, offer the most comprehensive care for the most severe cases. OHSU also serves a tremendous number of patients. In 2023, I believe your hospitals and clinics served over 300,000 patients. So do you foresee any of these cuts that we're hearing about or potential cuts having an impact on direct patient care?
Well, one of the things that the Trump administration has spoken about, but we haven't seen it quite yet, is cuts to Medicaid funding. And as you know, OHSU's commitment is to the underserved populations. It's one of our highest commitments. And by that I mean rural folks, people from low-income communities, people who maybe have difficulty accessing care. And Medicaid and Medicare and the uninsured are the highest priority patients for OHSU. If those cuts occur, it will be very difficult for patients to get the kind of care they need. We already have a lot of wait times. We have, OHSU sees a lot of complex cases. People with Medicaid who get cut are going to have difficulty getting their treatment without that Medicaid support.
I want to switch gears a little bit. As we mentioned at the start of the show, there have been a number of personnel changes in the last few years at OHSU, including the notable resignation last year of the CEO of the Night Cancer Institute. You mentioned him, Brian Drucker. He had served as the Institute's director for 17 years, and in a letter announcing his resignation, he said the institution had, quote, lost sight of what is crucial and forgotten our mission. You helped lead the Night Cancer Institute at some point as COO previously. Can you tell us what you think he meant by this and what went through your mind when you heard that?
Well, first of all, Brian's a friend. I worked with him. I've known him for 25 years. He's an amazing physician and scientist. And I know that Brian was frustrated by some of the things that he felt were not going the right way at OHSU. But I was very sad and disappointed by that. When I came back to OHSU, frankly, Brian was one of the reasons among many that I chose to come back. But we have a good relationship. I disagree with Brian, and I said so publicly. My view is what I wish he had said. I don't know what he meant to say, but what I wish he had said is that OHSU was probably distracted from, at least leadership was, from its missions. But I can tell you that we have 22,000 people there working every day who are focused on their missions, and I'm so proud of them, and the student learners we have. They're incredible. You've covered a lot of these stories, your TV station, and I'm grateful for that. But I wish the word could get out more about everything that OHSU does.
Of course, let's talk about the major move by OHSU, the proposed merger between Legacy and OHSU, which would absorb the Legacy health system and would become OHSU Health. So together, this would make OHSU an even larger player in healthcare. It would control 5 of the 6 hospitals in Multnomah County, 7 of the 13 hospitals in the metro area. The merger is going through the regulatory process now, which is expected to wrap up, I believe, in March. So last year, OHSU laid off about 500 people and has acknowledged its financial challenges. So with these two things in mind, how is there the appropriate funding to acquire Legacy right now?
Well, OHSU still has a strong balance sheet, and our year-over-year revenue is growing quite rapidly. The challenge that OHSU and every healthcare organization in the state is experiencing and around the country in many cases is the increased costs. Inflation has really hit healthcare in a big way, labor costs and supply costs. But OHSU has the resources, the capital to invest in Legacy's facilities, which is one of the important commitments we've made because Legacy's facilities are underutilized. And one of the goals of this merger or acquisition, if you will, is to improve access, which means to reduce wait times. The wait times in Portland area are unacceptably high. The status quo is definitely not working, and it's one of the highest wait times in the country.
On the note of the layoffs, I know you mentioned you think this will help with efficiency maybe overall, right? Generally speaking in patient care. We know that the university committed to no layoffs 6 months after the deal has closed, if it does. So does that mean there are planned layoffs for after that?
First of all, thank you. Layoffs are terrible. I think it's one of the worst things that organizations sometimes have to do. We don't have any plans for layoffs. We've committed actually 12 months for people from represented bargaining groups, 6 months for unclassified employees. We don't have any plans for layoffs, and we don't intend to have layoffs. We hope to grow toward more efficiencies.
The process for the merger review, as I mentioned, is in the community review board phase right now, with the Oregon Health Authority welcoming public input. Public comment has been strong both for and against this merger. One letter opposing the merger said in part it would, quote, ultimately worsen patient care, reduce accountability in ways that are even now evident among OHSU's current business model. A consolidation of 2 such significant healthcare systems unnecessarily reduces competition and patient choice, as well as further monopolizes the labor market. What do you think about that? What's your response?
Well, this is not like a typical merger. Oregon has one healthcare organization, one academic medical center in the state. It's OHSU. We're the only organization in the state that's accountable to elected officials. And so our job, which is set by law and which we embrace, is to improve the health and well-being of Oregonians. We're the only institution in the state that is accountable to the state like that and to the citizens of the state. Other organizations, which are good organizations, are regional. They're not focused on Oregon, and that's our sole focus. Also, this isn't about capturing market share. It's how do we serve patients better? How do we create more continuity of care for the care experience? How do we build on the Legacy and OHSU collaborations? We have a very strong collaboration with the Knight Cancer Institute and Legacy's cancer program, and also Dornbecker and Randall Children's Hospitals. These are just examples. We can do a lot more if we're one organization for the benefit of patients.
So speaking about this being a public organization accountable to Oregon, if this merger goes through, how would this work? Because OHSU being a public entity, Legacy being a nonprofit, more privately run, how would these two merge together? Has this happened before? Have we seen that in other states or even?
Well, it's a great question. We have seen something like this, and I used to practice law, but I turned my license in, so I don't want you to ask me tough questions about the law, but basically Legacy is a nonprofit organization which has ultimately a religious affiliation in it, and it's a nonprofit with a single member. So what will happen is OHSU will become the sole member of Legacy. There's no shareholders involved. And then the Legacy employees will become public employees, just like OHSU. Now, Legacy has some independent physicians, and we'll respect that. We value independent physicians, and we'll continue those relationships, and we value them very much. They're very important to the community health network that is represented by Legacy Health System.
And then finally, if the merger doesn't go through, I mean, we expect that it will, but if it doesn't, what does the future of OHSU look like?
We'll continue doing what we're doing. We have some affiliate relationships already. We are challenged by access because OHSU is experiencing twice the average demand to get into our hospital and our system. And I'm confident that this will go through, but if it doesn't, we'll continue to develop those affiliate relationships. We'll work on the access with our partners in the community, including Legacy. I think that the state has a bigger access problem. Rural hospitals have challenges, and we are a hospital that works very closely with the rural community. We'll expand our residency programs as best we can, but none of those solutions will meet the test of changing the status quo, which is not working well in Oregon right now.
Well, we wish you all the best in your new post, and thank you so much for coming in today.
Thank you very much.
Really appreciate it. And coming up after the break, we talk diversity, equity, and inclusion practices as it takes a spotlight on the national stage. We'll be right back. And welcome back to Straight Talk. We are continuing today's episode with a discussion about diversity, equity, and inclusion practices and the growing debate surrounding them. Joining us to talk about this hot button issue is Shari Dunn, a DEI consultant and author of the book Qualified, which tackles how DEI initiatives and race collide in the workplace. She's previously worked as an attorney, a journalist, and an adjunct professor at the University of Portland. Shari, thanks so much for coming on Straight Talk today.
Thanks for having me.
So I want to ask you first, DEI has come onto the national stage. A lot of people talking about it. Yeah. So to you, what is DEI?
Yeah, that is such a good question. So on just the face of it, it's diversity, which diversity is all around us. Our human beings are diverse, plants. It's equity, which is equitable, how we behave, how we're being fair and inclusive, right? So that's what it means on its face. What people are talking about, what they think it means, is something very different from what it actually is. So diversity, equity, inclusion in the workplace is really designed to ensure that there are opportunities for people who historically have not had opportunities, right? That is what it is. And once folks are in the workplace, it's designed to make sure that the workplace is inclusive and reflective of their experience, right? And but what people think it is a series of preferences or people who are unqualified or things of that nature getting jumped ahead of positions and jobs. And that is just simply untrue.
What are some of the major policies or changes that we've seen that have come out of DEI, maybe in the last several decades or even before then, that have become norm for us now?
Absolutely. When we think about flexibility in the workplace, we think about childcare, we think about having time off, men and women, to take care of your kids. When we think about disabilities and inclusiveness in the workforce, those who have both physical and non-physical disabilities, accommodations in the workforce. When we think about more women in positions of leadership, when we think about more people of color in jobs, those are the ways in which diversity, equity, inclusion show up in the workplace and, quite frankly, help everybody.
So in your book Qualified, which you have here,
I have my book here.
There we go. You talk about misinformation that you think has muddied the idea of what DEI is, and you're talking about it a little bit, these misconceptions, but what do you think people, what are some of the biggest misconceptions that people have around?
Yeah, I think the two biggest misconceptions are that, number one, diversity, equity, inclusion is about discriminating against white men. I think that is a big misconception. It is about ensuring that there are opportunities for people who historically have not had opportunities. And so it's more of a leveling of the playing field than an altering of the playing field. One of the things we misunderstand is the playing field was not level. It was actually tilted. And in leveling the playing field, some people perceive that as being unfair. The second misunderstanding is that it's lack of qualifications. People who have no qualifications, less qualifications, are getting all these jobs, and that's just simply not true, and the data tells us that's not true.
So I want to talk about the current presidential administration. He has made his stance very clear on DEI after signing an executive order aimed at curbing government DEI programs, calling them, quote, wasteful and discriminatory. More recently, the president seemed to insinuate without evidence that DEI programs were to blame for a deadly collision between a plane and a military helicopter in Washington, D.C. that killed 67 people tragically. Shortly after that, he signed an order to review all FAA hiring decisions and changes to safety protocols over the last 4 years. So let's hear this soundbite.
the FAA's diversity and inclusion hiring plan, which says diversity is integral to achieving FAA's mission of ensuring safe and efficient travel. I don't think so. I think it's just the opposite.
Are you saying race or gender played a role in this tragedy?
It may have. I don't know. Incompetence might have played a role. We'll let you know that.
What are your thoughts on the president seemingly linking this tragic event to DEI?
Yeah, I think it's reckless. I think it's outrageous. And, you know, in this particular incident, this was specifically someone who was disabled, who had a disability. And what ended up happening is people were accusing those with disabilities, saying they shouldn't be in jobs, they shouldn't. I mean, this is outrageous. People with disabilities, and again, many of us, family members, friends, children, have a variety. ADHD is a disability. We have all. So are we saying that people with disabilities are unable to work and they can't have jobs? And, you know, preliminary information is saying there's just very specific issues related to the crash, nothing related to diversity, equity, inclusion.
A Pew Research poll from late November last year shows Americans' attitudes towards focusing on DEI in the workplace souring. 52% of those surveyed say focusing on increasing DEI at work is a net positive, compared to 56% in February of 2023. In both cases, Democrats, women, Black, Hispanic, and Asian workers were more inclined to see focusing on DEI as mostly a good thing. Republicans, men, were the most likely to see a focus on DEI as a bad thing. So I want to ask, why do you think we're seeing such a fierce pushback when it comes to DEI programs and initiatives in these groups and from the White House even? You know,
it's messaging. And it's a decade of messaging. There are organizations such as the Claremont Institute who have been working on an anti-inclusive message for years. It started with affirmative action, saying affirmative action was unqualified, and then it went to inclusive workplaces, and now it's DEI. And, you know, quite frankly, they've been incredibly effective in their messaging. They have put out a messaging that everyone has heard, and it becomes, you know, a fact to people. And there really hasn't been a strong balance on the other side saying what it is not. They have not had that level of messaging.
Do you see any merit in the criticisms against DEI?
Well, what I will say about this is that every modality, from workplace communication training to consultants who come in and do management training. I used to work in television news. You have these consultants who come in and they work with you. Some of them, I don't know if they ever were on a news set in their life. I don't know what they're talking about. They say a bunch of nonsense. There are a lot of consultants who aren't good at their job. So for sure, there are diversity, equity, inclusion consultants, just like there are communication consultants, just like there are hiring consultants. And they can be better and they can do better, but we don't outlaw consulting and communications. We don't outlaw management consultants. And some of them do great harm because they do not know what they're doing. So I would say that diversity, equity, inclusion, just like any discipline, can be better, have people do the job better, but to outlaw a concept, I mean, I think Americans really need to sit with that there is this move to outlaw an idea. And that is, I think, alarming.
Just going back to kind of the bigger, broader DEI conversation we're seeing on the national stage, we're seeing private companies like Target, Lowe's, and McDonald's, as well as government agencies, turn away from these DEI initiatives. Some people are happy that this pivot is happening. So I want to ask, is there anything you would like to say to those people who are happy at this trend that we're seeing right now?
Yeah, I would say don't be too happy. I mean, Costco and Goldman Sachs and others are saying they are going to stick with their initiatives. So there's an equal size list of people, but see, that goes back to messaging, marketing, and where we focus. There's an equal size list of people and corporations who are saying they are going to stick with their DEI initiatives, but that doesn't get as much lift. That's number one. And then the other thing I would say is it's cutting off your nose to spite your face. Because at the end of the day, diversity, equity, inclusion initiatives have ended up helping us all in ways that I talk about in the book. I talk about how they've helped men, women, people of color, the disabled, and I think that, I think people have been led astray, and they're going down a road that is not a road that is beneficial to any of us.
Shari, thank you so much for coming on the show today. And thank you for joining us. Coming up next week on Straight Talk, we sit down with Oregon's 18th Attorney General Dan Rayfield, who's been busy since stepping into office. We talk lawsuits challenging executive orders from the Trump administration to what else he hopes to accomplish. We'll see you next week here on Straight Talk. And until then, be well, and thanks for watching.